If you have piles, it can be very uncomfortable. Most people get piles. You are likely to get piles once in your lifetime. Hi family, welcome back to my channel. So in today's video, we're talking about all things hemorrhoids. We're going to be talking about the different types of hemorrhoids, how to treat hemorrhoids, the best treatment available for you to treat your hemorrhoids, and of course, how to prevent hemorrhoids from occurring in the future. Let's talk about hemorrhoids. Hemorrhoids, also known as piles, are normally enlarged blood vessels that are seen in or around our anus. We all need blood vessels. Why? Because blood vessels plays an important role in our incontinence. So let's move on by talking about the different types. We have two types of piles. We have the external piles and the internal piles. So internal piles are normally found at the start of your anal canal. They may push down or you can push them back in, and they are graded based on how they come out of your anal canal. External piles are normally found further down your anus. They can feel a bit lumpy. You can actually see them and feel them, and they are normally filled with blood clots. And it is possible to have both. So it's possible to have external piles and internal piles. We will all have piles at some point in our life. I've had piles before when I was pregnant with my babies. Let's move on by talking about the causes of piles. So piles can be caused by pregnancy, it can be caused by constipation, it can be caused by doing excessive exercise. You can also get piles from straining when you are pooing. If you've had piles before, you know how painful it is. Yes, there is pain at the back, so you get pain around your anus. There is discomfort, there's itchiness, and of course, as I said, if you have external piles, then there you feel a bit of lumps around your anus as well. There'll be blood. So once you wipe down after pooing, there'll be bright red blood on the tissue. So these are the symptoms of piles. If you're someone that had blood after pooing and it's mixed with your stools, then it's important to see your GP, because this could not be piles. It could be symptoms of something else. Let's move on by talking about the treatment for piles. So depending on the type of piles that you have, ideally you want something to get rid of the pain or numb the area, relieve the itchiness, and of course shrink the piles if you have external piles. So I normally advise patients to get a product that contains a corticosteroid, so hydrocortisone, just to get rid of the inflammation, the pain, and of course get something to soothe the area. You can also get something with lidocaine in it. So lidocaine is good for pain. It will numb the area so you wouldn't be able to feel much pain. So you can get something called anisole. So as I said earlier, it depends on the type of piles that you have. So if it's an external pile, then I advise you to get either a cream or gel. You can apply it to the area to, of course, numb the area and get rid of the pain. If it's an internal pile, then you can get suppositories. If you have both, so if you have external and internal, then you can get the cream with suppositories as well. Please remember, steroid-containing products can only be used for 7 days. If you do not see any improvement after 7 days, then I suggest you speak to your healthcare provider. They'll be able to prescribe or give you an alternative. If you are someone that's passing hard stool, then you want to get a mild laxative such as lactulose, or you can even get fibergel, which can soften your stool to make it easier for you to have a good bowel movement. You can also use products such as paracetamol to help with the pain. Avoid using products that contains codeine, so products such as cocodamol. This will make your constipation worse because it can cause constipation in itself. So let's talk about how you can prevent piles in the future. So if you're someone that's prone to having piles, then number one, I would advise you to avoid straining when you're having a pool, because straining can put stress on your blood vessels, and of course it can lead it to being enlarged and causing you piles. Number two, I would advise you to increase your fiber intake. What fiber does is it can soften your tools and make it easier for you to pull the next time you have piles. Number three, make sure you're taking enough water. So drinking enough fluids will help you. And of course, try and limit your caffeine intake, because this can also cause dehydration. You can also use water to wash around your anus and keep it clean and dry. Make sure that you're patting it with a soft cloth instead of a hard tissue. Don't make that mistake of using hard tissue when you have external piles, because you don't know how painful that is. Of course, it's also important to keep active, at least have 30 to 75 minutes of vigorous exercise a day. This will help prevent you getting piles in the near future. Alright guys, I'm going to end the video here. If you enjoy watching this video, please give it a thumbs up, as this helps my video gets out there to help other people. If you enjoyed this video, don't forget to share with your family and friends. Let them know, and then don't forget to subscribe to my channel. I shall see you all in my next video. Take care. Bye.